Idiots. Idiots. That's what the president called Dr. Anthony Fauci's and the public health experts in the federal government. The president said, people are tired of COVID. I have the biggest rallies I've ever had, and we have COVID. People are saying, whatever, just leave us alone. They're tired of it. And then he added, people are tired of hearing Fauci and these idiots, all these idiots who got it wrong. The words of the President of the United States, Donald Trump, in the midst of the worst pandemic America has seen in over a century. 220,000 dead and counting. What lies ahead with this COVID epidemic, which the president is so tired of hearing about? What have his so-called idiots told us about the future of COVID-19? Here's what they've told us. More than 70,450 new coronavirus cases were reported in the United States on Friday, the highest figure since July 24th, according to the New York Times database. More than 900 new deaths were recorded, and over the past week, there have been an average of 56,615 cases per day, an increase of 30% from the average 2 weeks earlier. Is this a political commentary, these facts? No. These are the numbers and statistics of reality, a reality which President Trump refuses to acknowledge. How are we doing when it comes to COVID-19 pandemic compared to the world? Well, we have 5 times the infection rate of the nation of Germany. What's going on here? The great United States of America has 5 times the infection rate of Germany? Well, let's get across the ocean. Let's bring it to this side of the Atlantic. How are we doing in comparison to nations here? Well, let's compare the United States to Canada. The COVID death rate in the United States is 2.5 times the death rate in Canada. Well, what did Justin Trudeau know about this epidemic that Donald Trump did not? He knew that it took leadership to deal with it. He knew that we had to step up as a nation and gather together all the people of this country in common purpose to beat back this virus. And he failed to do it. President Trump failed to do that. He said to the governors, you're on your own. Go out and find protective equipment. Find ventilators. See what you can do on the open market instead of using the power of the presidency and the leadership of the presidency to help make certain that every American had access to what they needed to stay safe. And how did he do in setting standards for dealing with this deadly virus? Well, first, he denied it was deadly. He argued it was going to go away. When it gets warm outside, it'll go away. It's a hoax. You remember those statements. And do you remember that incredible press conference where the president went off on some tangent about disinfectant and Lysol? It was sickening to think that the leader of the free world would do that. And how about the example set by the president? To this day, to get this president to wear a mask is a rare occurrence. And there he was, just days after being helicoptered out to Walter Reed Hospital, returning to the White House, making his triumphant balcony scene, standing before the American people and ripping off his mask just to tell them how tough he was, how lucky he was, and to really tell the American people, don't take this mask business seriously. He can say the words, but he just mouths them. But the fact that you can see his mouth is an indication that he doesn't believe them. And here we are. Well, fortunately, in the earliest stages of this pandemic, this Congress rose to the occasion. It was March 26th. We call it the CARES Act. It was indeed a comprehensive effort to deal with the coronavirus, a comprehensive approach. We imagined all the possibilities. We saw the economy sinking under our feet, and we came together with a vote of 96-0 here in the United States Senate, bipartisan vote of 96-0 for a bill that we wrote together, Democrats and Republicans, sitting together. It was an amazing day, and I'm glad we did it, but there was one clear shortcoming. We assumed when we passed the CARES Act that come the end of July and first part of August, this crisis would be behind us. It isn't. And at the end of July, for example, the federal supplement of unemployment insurance ran out for millions of Americans. And in the first part of August, the loans to small businesses dried up as well. What's happened since? Well, on the other side of the rotunda in the House of Representatives, Speaker Nancy Pelosi, 5 months ago, Mr. President, passed her HEROES Act. It was $3 trillion, comparable to the first effort. She sent it to the Republican leader of the Senate, Senator Mitch McConnell of Kentucky, for him to do his part. It is a bicameral legislature, and his part would require coming up with an alternative and taking that to conference. Did he do that? No. He refused to acknowledge it and mocked day after day after day the efforts of Speaker Pelosi, questioning whether or not they were enough or sincere or too political, on and on and on. Did he pass his own measure? No. Well, then negotiations started between the president, his White House representatives, Speaker Pelosi, Leader Schumer, and they invited Senator McConnell as head of the Republicans in the Senate and Kevin McCarthy, head of the Republicans in the House, to join in this bipartisan negotiation. McConnell and McCarthy declined. They would not even sit in the chairs during the negotiations. They simply came, Senator McConnell's case, simply came to the floor on a daily basis to mock every effort to respond to this COVID-19. Well, this is not a news bulletin, but we are 2 weeks away from an election. And guess what we're going to do on the floor of the Senate today? We're going to entertain a new idea by Senator McConnell of how to cope with the COVID-19 pandemic. It turns out that it's a scant list of his priorities. Not surprisingly, the first priority is an issue he's called his red line on the floor over and over again: to give immunity from liability to businesses who fail to take the necessary steps to protect their employees and their customers from the spread of this deadly virus. That's his first priority. He said that even before the first issue was raised as to what would be included in this. The first thing that Senator McConnell insisted on was protecting these businesses. How do the American people feel about that? Well, they're pretty clear. They believe if you put that immunity in place, that many businesses won't do what they need to do to protect their employees and customers. They worry that this gets them off the hook instead of putting the responsibility clearly on their shoulders. The good news is the overwhelming majority of businesses that I know are really trying to do the right thing. The bad news is they're not sure what that is. They hear about CDC guidelines that are ignored and mocked by the president, and they hear about the possibility of other standards that will be used. We've had hearings before the Senate Judiciary Committee when a Texas businessman with a string of convenience stores, I think, came to us and in good faith said, I don't know where to turn for a standard. CARE. What am I supposed to do if I want to protect everyone coming in my store, employees and customers alike? I thought his statement was genuine. I really believed him, and I still do. But it's no excuse for what we failed to do here. We failed to come up with a national standard to protect people from the spread of this virus. Instead, Senator McConnell comes to the floor and says, if you can find any standard by any level of government good enough, you're off the hook. That is no way to lead in the midst of a deadly pandemic. It's not the only issue. There are many others. You take a look at what's missing in Senator McConnell's proposal. No new funding when it comes to state and local governments. Remember the phrase, defund the police? You heard it from the right wing about the left wing of American politics, wanting to defund the police. Well, Senator McConnell's action will defund police at state and local levels because these units of government won't have the resources to hire the policemen they need, the law enforcement officials they need, nor the firefighters, nor the teachers, nor the healthcare workers. But that's priority one for Senator McConnell. No help. No help for state and local governments. For fear that you might actually send money to a Democratic mayor or a Democratic governor, spare me. That virus is not looking for party registration. It's looking for kindling to light the fire of infection. Housing. Well, what does the McConnell proposal deal with housing? No funding. No funding for housing or rental assistance. The stimulus checks, $1,200 stimulus checks. I listened to talk radio back in Chicago, and people are wondering, is it possible we're going to see a $1,200 check? Well, you won't see it in Senator McConnell's proposal. No direct stimulus payments. How about unemployment benefits? The federal unemployment benefits that expired on July the 31st were $600 a week over the state amount, whatever it might be. Some people may have made more in the process than they did at work, but most were struggling to get by. If members of the Senate have not been in touch with Real America in a while, they may think that folks with these checks were doing binging on Netflix and eating chocolate-covered cherries night and day. That's not the case that I see back in Illinois. People who've lost their jobs, even at the time they received these unemployment checks, were still struggling to pay for the mortgage, pay for the rent, pay for the car, keep up with the credit card bills, and put food on the table. So what does Senator McConnell propose that we do? He proposes that we cut in half that amount to $300 a week. I guess back in Kentucky, it's a little different world, at least as he sees it. But where I live, that means a pretty dramatic cut in survival pay for people who've lost their jobs. On the healthcare side, this is the one that troubles me the most. Couldn't we all agree that we don't test enough for the COVID-19 virus in America? There are about 1 million people tested a day. Public health officials say, well, you need at least 4 million. Others say, but if you truly want to reopen the economy and reopen the schools, you need 14 million a day. So you would guess that anything we pass would really zero in on testing to find out those who are positive, to do the contact tracing, to warn those who may have been exposed, and to try to contain the virus. So let's take a look at what Senator McConnell thinks when the priority of testing. $16 billion for testing. How much did the Democrats propose? Nancy Pelosi propose? $75 billion. And let me add, the McConnell bill provides no funding for hospitals or health care clinics. No dedicated funding for nursing homes where we know the populations are so vulnerable. When it comes to the reality of what we're facing in this COVID-19 pandemic, the McConnell bill, which is coming before us this afternoon, is deficient in testing at a time when we are facing so many infections. On nutrition, the McConnell bill, no SNAP benefit increases or funding for food banks. Education provides $105 billion for education stabilization funds. 2/3 of the K-12 funds will be held until schools provide a reopening plan. And of course, the voucher program. Postal assistance, the McConnell proposal alters language in the original legislation to change the borrowing authority. The Postal Service is doing its best, and I thank the men and women who are engaged in it. We should do more than thank them. We ought to fund them and give them a helping hand. So what it boils down to is this. If this is a real pandemic, if we want to believe the public health experts whom the president has called idiots, like Dr. Anthony Fauci, who's been my friend for 20 years, if we want to believe the public health experts, we need to address this in a serious manner, as we did last March in passing the CARES Act. This is not a time for people to cover their backsides politically. It's a time to remember that the American people need our help more than ever. A half-hearted, half-inspired effort to do this will not answer the call. We need to stand as a nation on a bipartisan basis. How does it start? It starts when Democrats and Republicans sit at the same table, which has not happened. It starts when we agree, both parties agree on what the priorities must be, and it starts when we stop the speeches and start with real action to pass legislation like the CARES Act, which passed with 96-0 on this floor. It is time to take this deadly virus and epidemic seriously. I yield the floor.